I'm Angel Knowles, and I am an outpatient clinician here at Frontier Behavioral Health. We provide mental health services for kids, adults, families, with a range of experiences and issues. So we've got several different types of therapy that we do, and different outpatient clinicians are kind of specialized in those. But I think Frontier as a whole, our outpatient clinicians, their goal is to kind of help people find their strengths and walk with them through a difficult and rewarding process. I definitely got into this field mostly because I wanted to make a difference. And pretty quickly I realized that making a difference can look really different depending on the person. So my idea of progress and success really shifted. But absolutely, I think ultimately I realized the importance of people just being seen and heard genuinely. And if I can do that for someone, then I know I'm making a difference. So a typical day honestly kind of changes each day, which is something I love because there's some variety from day to day. But for the most part, when I come in, I usually have a little bit of time to settle in and probably make coffee, check my emails, check my voicemails, things like that. And then the majority of the day is spent face-to-face with clients. And in there, we'll have individual sessions. We also facilitate some therapy groups. And then there's also paperwork, of course, doing your documentation, following your appointments. We do something called phone coaching, where we talk with clients briefly throughout the week if needed, to kind of bridge that gap between therapy appointments and the rest of their week. So we'll do those calls. And I interact with my team a lot, my coworkers. The job can sometimes be emotionally difficult, and so we meet as a team, actually for over an hour a week, to just kind of talk and catch up and get support. To become an outpatient clinician, most of us have master's degrees. There are opportunities to work within the mental health field, providing services at Frontier to clients at the bachelor level, but most of us choose to go on and get the more of that education and take on the title of an outpatient clinician. And beyond that, I think there's lots of opportunity for growth, not necessarily with degree education, but there's so many. That's one of the great things about this field. There's so many things that you can get certifications in and specialized training to kind of help broaden and specialize you in areas that interest you. And then you can provide those things to clients as well. Yeah, I think some of the skills that are important in this line of work would be having an open mind and a willingness to learn the unique needs of all the people that you're going to be serving, as well as patience. And also, as much as being able to identify other people's needs, being able to identify your own and having a good handle on how to take care of yourself. I'd say that there's an extreme demand for outpatient clinicians right now, kind of all across the board. I think especially in the time of our world and life that we're in right now, there's been a significant increase in the need for mental health services in a lot of different ways. So I would say that the demand is high. I do love my job. I definitely won't lie and say that it's easy, but I definitely didn't get into the field to do the easy thing. I think that one of the most rewarding parts of this job is being a part of someone making progress and recognizing their own progress and seeing their strength within it, and knowing that I got to provide a space where they had the ability to do that.